I realized that the problem was malnutrition, because almost 50% children who die of diarrhea and pneumonia, they are malnourished. So this was the, this is the latest data. As you can see, pretty much all red. And all these children are stunted. Stunted means they are less than -2 standard deviation for height. And this is what I thought that, as a pediatrician, I think this is an emergency, because it's not only increasing mortality in children, but it's also decreasing the IQ. So our future generation is at stake, because if you have 36% children who are stunted, so they are basically, they will not be able to give it back to the economy of our country. Our focus is very much on proper technique of breastfeeding. We have improvised one technique, cross-cradle hold. We also focus on weight gain, which is equal to milk transfer. Also focuses on complementary feeding, because after 6 months, the children, they don't do well at all. Only 11% children in India are getting proper food from 6 months onwards. So we also focus on that in our training. We teach healthcare workers WHO growth charts and target weight gain. Thanks to Professor Kannan, that now we have almost 105 tutorials. We pass on this message to all the healthcare workers, and we select best people who have performed well in our exams. And through Health Spoken Tutorial, again, this are again translated into 15 constitutional languages of India. They are also being translated into some tribal languages. These are all the topics. Various topics on maternal nutrition, breastfeeding videos, complementary feeding. In one of the aspirational district of Madhya Pradesh, all these doctors and nurses are watching our tutorial. After we train them in face-to-face training, we train about 250 healthcare workers. And then once they become proficient by adopting 10 mother-baby diet, because our goal is just not kind of showing videos and let them loose. What we want to do is they have to show that content knowledge in application-based knowledge. So they basically adopt 10 mother-baby diet in different phase groups, like, for example, ANC mothers, newborn babies, and complementary feeding. And then they have to show results in those 10 mother baby diets. We have also published our results in MCN journal, which is international journal. And we found that mothers who were taught this proper technique of breastfeeding had 3 times less malnutrition at 3 months of age. Here, what we do is, once they come for face-to-face training, we handhold them for next 6 months while they are adopting babies. And through WhatsApp, we teach them how to latch the baby, whether it is correct or not. So this is a very crucial part of our training. So that's how our pedagogy is.